what's it like actually working in the emergency department? These are common feelings that staff have, as well as the benefits of saving lives, etc. They're often feeling depressed, fatigue, stress, burnout. It's not particularly great feeling in terms of their own well-being to patients. So for themselves, there's high job dissatisfaction, the staff shortages, high absenteeism, high staff turnover, so they have to keep retraining new staff, so you've got this greater cost again to the NHS. And for the patients, this also has a knock-on effect in terms of their medication, potentially poor prescriptions, over use of drugs, less contact time with staff. So what are the stressors that exist? I know we're here talking about the environment, but of course there is this wider issues going on. For example, resource problems, management structure, dealing with potentially aggressive patients because of how they're feeling. But the physical environment is there. It is an important stressor. This is what staff in emergency departments have said. They've actually called it their 5th biggest working problem. The tannoy was a particular issue, so is there any way of communicating to other members of staff trying to get hold of them? You'd have this loud tannoy go off. So what would be the solutions around that? Could it be done in a certain way so that it was clear, could still be heard, but not be at the loud levels it was being played at? Similarly, there were other communication difficulties, particularly in the handover. So between one shift and the next shift coming in, a sister would tell all the problems, all the issues with each of the patients, pass on the information. But they were having trouble overhearing, all the other staff members were having trouble overhearing what this one sister was saying. So these are some of the clips from the interviews. And again, they're talking here about struggling to hear the other staff members. So this has clear implications for the transfer, the patients, and misinformation and delay in proper patient care. So they're struggling with this background noise. In the children's ward, again, it was particularly noisy at times. Sometimes it'd be quiet. By the times you've got all these children, all their parents, crying, they're in pain. So it ends up that, you know, it's not an environment they want to be working in. And then the tannoy, it even went off every time within each of the interviews. So they would literally stop talking to me. They couldn't continue. They had to delay their patient care because you couldn't hear what was being said. Deal with it. They're like, okay, this problem exists. It's noisy. Just have to get on with it. But in the long term, it's still having an effect on them. It's still having those physiological impact. So it's not necessarily the best thing for them. And indeed, as you can see here, there was that effect. Even though they were trying to cope, they were still feeling hot, sweaty, they're still getting annoyed, frustrated. And overall, they just didn't feel that they were performing at the best that they could be. So there was that low job dissatisfaction. And in a knock-on effect, they're feeling tired, they can't perform as well, they're slow in concentrating, or slow thinking, and at times they're just having to leave the patient when they don't feel that they should be in that position.